Welcome to the information session of the Light and Heat and Learning of Light and Heat, a learning community for transformation, accountability, and equity in healthcare. Next slide, please. I'm going to ask you to go ahead and select your language selection. We do have an interpreter that's with us, Miguel, who will be interpreting. So go ahead and select your language so we can make sure that we make the appropriate accommodations for all of us here today. Next slide. So with regards to housekeeping, make sure that you use the Zoom chats feature for comments and sharing with each other and also communicating with us. We're going to have 2 or 3 polls during the course of our time together, so keep an eye out for the polls function. Use the Q&A session for Zoom to ask a question. Our slides will be posted to the web page, and the application and the materials will also be shared after the webinar via email. You will also have the recording that's going to be posted to our webpage, so you can circle back as reference information and also share with others that you think might be interested but couldn't be with us today. Okay, next slide. And we have our social media handles here. So please, if you can multitask better than I can multitask, please feel free to include our organizations in your social media communications. Okay, so let's jump in. My name is Tanae Hamilton Franklin. I am Vice President of Health Equity and Stakeholder Engagement at HealthLeads, and it's really good to be with you all today. We have our presenters with us who you're going to get to know, my colleagues and now friends that I've been working with on this effort for the past couple of years: Jeremy Cantor, Deanna Lewis, Rishi Manchanda, and Sadhna Devaraja. You're going to learn a lot about how we're thinking about the Light and Heat Health Equity Guide and how we've rolling out the learning community, so stay tuned. But first, I'd like to go ahead and turn it over to Rishi and Sadhna to review the Health Equity Guide, which you all are probably somewhat familiar with, but I think it would be helpful just to do a quick introduction and review of the Health Equity Guide. Sadhna, I will turn it over to you.
Thanks, Tanae. And I think, would you like me to go over the objectives of our first poll as well, or?
Thank you. I am, yes, please go ahead, Sadhna.
All right. Well, thanks for joining us today. We're really excited for this session. And so by the end of today's webinar, we're hoping that everyone here in the room will be able to get a good sense of this learning community that's built on the Light and Heat Guide that was published a couple years ago now. We want to include make sure that there are enough details for you to figure out and determine whether you should apply, if it's a good fit for you. To get a little bit of a primer on the guide, we have other resources, including the guide itself, as well as a previous webinar they can use to better understand the guide, but we'll give you a little bit of a primer of what was in the guide as an overarching framework for this learning community and to better understand how to get involved, application process, and the timeline. If you go to the next slide. We were curious before we get started, just to get a better sense for how familiar you are with the guide. So that poll should be up on your screen. And there's a second poll within that same set. So if you scroll down within that poll, so the first poll question is, how familiar are you with the guide? From not familiar to extremely familiar. And then the second question is, based on what you know so far, what brought you to the webinar? And this will just help us, level set our comments and make sure that we're engaging everyone kind of at the right level. I'm going to give it just a couple more seconds here. Maybe I'll count down from 5, 4, 3, 2, 1, and close the poll out. And so it looks like there are, over half of folks in the room are not familiar with the guide. So we'll do that little bit of primer and also make sure to link in the chat resources so that you can do a deeper dive on the guide itself. We do see there are quite a few people, though, the other half that are somewhat familiar to extremely familiar. And then based on what brings you to this webinar, love that you want to work within a community. So maybe for folks who have seen the guide or kind of know a little bit about it, you want to work with others to achieve similar goals. Some of you came here to learn more about the guide. And then, of course, learning more about the community and the application process. So we'll spend time in all of those sections today. So we can pull down. We go to the next slide. So
don't even think about it. You're not going to make it.
In the first place, these are just kind of some quotes that are framing for what motivated us, what we were hearing from the field, right? And I am not going to read them out loud, but I'm pretty sure that this is what brought everyone to the room as well, and just wanting to be in shared community as we kind of achieve our goals towards equity. If you go to the next slide, we detail a little bit about who this guide is meant for. And as well as the learning community. So while we are welcoming of all of like the stakeholders in our ecosystem, this is really the language within it and kind of the perspective, the vantage point that we chose to take is really meant for leaders at medium to large nonprofit hospitals, as well as integrated delivery systems. And so those are the primary audience. We also want CBOs as part of the teams, as part of the conversation. Advocacy groups, policymakers, because we are looking at structural changes as well as accountability that is going to require this kind of external vantage point to be part of our teams. And of course, patients, caregivers, and family members for whom all of this work is based on. This is, who we're doing this for. And so if we go to this kind of last slide, just kind of setting the stage for us here. These were our guiding values as we were thinking about the guide, as we received feedback on it in the first place, as well as when we were designing this community. Our guiding values are on the screen, and just really putting them out there to make sure that we're all aligned in this space together about what's driving this work. We want to make sure that we're looking at health equity, racial equity, which will require power sharing. It requires the commitment to that, to systems change, to accountability, and to really doing something comprehensive and not piecemeal. And so if these values are resonating with you and are part of what is animating you to join us, then you're in the right space here. So I think then the next slide was just pictures of me and Rishi. I'm joined here with Rishi Manchanda, President and CEO of HealthBegins. I'm going to continue kind of going through the guide a little bit, but Rishi, please jump in if there's anything I'm missing, or if we need to pause for any questions. I'm not able to really see chat, so if there's anything that we need to pull up to the forefront, please let me know. So if we go to the next slide, I'm going to talk just for a few minutes about the Bringing Light and Heat Guide. It's the Health Equity Guide for Healthcare Transformation and Accountability. And what I'm going to put in the link right here, and Chris, thank you for that question about the link to the guide and previous presentations. The link that I just put in the chat goes to the Help Leads landing page, where you can find the guide, as well as the previous webinar, where we go into the guide in a little bit more depth. We talk about the different sections and give some more concrete examples. I have about 5 more minutes allotted here, so I won't be going into it in too much detail, but want to mention kind of what we meant by light and what we meant by heat, why this guide was needed, and what we think is required for its success. So if you go to the next slide. When we talk about bringing the light, what we mean is process. And so part of what we were hearing from the field across our 5 organizations was really thinking through a process to be able to make sense of all of the different possibilities that exist in kind of pursuing health equity work, right? So we thought through 5 different components to provide a structured process and pathway. And so you'll see them on the screen here. And what we wanted to do was make sure that, one, people knew that there is some sort of process that's possible, a pathway that you could take, but also that it's not linear, right? And that start points may vary within it. And while we understand that, still taking time to go through each of these steps and use them as kind of touchstones to be able to move our work forward. So if you go to the next slide, I can kind of describe a little bit of what that means. So you see in these first 3 sections of commit, build capacity, assess, and strategize, these are some of the components that you'll see in the guide. What do we mean by commitment? What does that look like? It means a clear, explicit commitment to internal stakeholders. It means something to external stakeholders. What does it mean to make explicit statements about partnering and sharing power? So within the idea of creating strategic goals, we want to make sure that we're making commitments through those goals, that we're building capacity, and there's kind of some descriptors in there, as well as then taking those commitments, taking the capacity, the teams, the partnerships that we've built, and creating an assessment, a way to assess and strategize. So this is kind of all in the planning pieces, right? That commitment, that building capacity, the assessment, and strategizing. If you go to the next slide, the last 2 components of this process are then, how do we change practices and how do we learn from it? How do we create this kind of momentum based on that planning that we did in the first place, the commitment, the assessment, strategy? How do we then make practices and policies at different levels, the patient level, the organizational level, community level, and societal level, to be able to actually create meaningful change? And so those are the kind of actions. These are example actions. We're not being prescriptive here, but we want to give enough kind of substrate for folks to be able to find examples and test them out. And then most importantly, learn from it. So collect data, share lessons, review the data, and then restart the cycle again. If you go to the next slide. The piece that really makes this guide unique, we think that a lot of what was in that bringing light process or the part about process in terms of bringing the light are things that we've heard from the field, are things that maybe you've discovered in your own work. But where we really saw a bigger gap, I would say, is in this accountability piece. So bringing heat for us means, how do you bring accountability? We know that it's not appropriate and it's not effective for institutional leaders to hold themselves accountable, and that many times other stakeholders may be more effective at holding institutions accountable for advancing health equity. And while that may be true, we can't completely, while we're doing this work, say that external stakeholders, that's their job to keep us accountable. There's a role for healthcare institutions to enable that type of accountability to happen, to respond to measures, to be in good partnership. And so when we talk about what is making this guide unique, we really think this bringing the heat piece is something that we were hearing a lot about and needed kind of more context and language around. If you go to the next slide. Within the guide and kind of in the webinar that preceded this one on the guide, we talk about some of those components of accountability. This is something that we would need to talk about further in community with everyone, but the components of accountability that we really drew up are community-centered governance, making sure there's redress, transparency and accountability, compliance, and consequences. And so just kind of really quickly on what each of those means. It's community-centered governance can mean including individuals with lived experience and members of historically marginalized communities, making sure they're meaningfully participating, right? There's clear mechanisms for shared decision-making. Redress is that community stakeholders have helped identify the institution's own history of inequitable systems, that they've kind of drawn up on processes or outcomes, and inform institutional redress and restitutions. And that the institution has taken demonstrable steps to redress and make restitutions for harms. Transparency and answerability is that the institution is sharing data, right, related to health equity and racial justice, makes it available to the local community. Compliance is that the institution is actively participating in monitoring and evaluation processes to ensure that health equity efforts are implemented effectively. And then consequences, right? That there's clear mechanisms and consequences when there are shortfalls. As I mentioned, I went through that quickly because the purpose of this conversation is not to really like detail what folks can do, but to give kind of that sense of the framework, as well as acknowledge that this is what we need to be in conversation about, to be able to talk through kind of what these examples are, what might work for your organization, what might work for your setting, and where to start with some of these pieces. So if you go to the next slide, and I'll go through this quickly, just kind of flash it on screen about what it looks like in the guide, right? We give examples of accountability using that same kind of process of commitment, building capacity, assessing and strategizing. So you'll see some of these examples here. And then if you go to the next slide, you'll see it also in, if we could go to the next slide. Yeah, there you go. You can see examples again in changing practice and policy, and how we learn. And so I kind of want to land on this next slide, which is that we've heard, including, you know, in the lead up to this webinar. And if we could just go to the next slide. Questions from folks in the audience, right? Like, how do you identify what's most important? How do you frame accountability measures in a way that's palatable? And what are incentives that can be provided that are ethical? How do you involve community in your work? As well as some of the things that you see on screen. And so we know that folks in this room, that folks in the field have a desire for how to start, what are the concrete steps, how do we think about components? And that's something that we knew we couldn't do entirely within a guide. The guide is just a guide. And what we needed to do is be in conversation with each other, doing the work to kind of learn how to be a part of constituent-led organizing efforts, how to first do no harm, learn about strengthening mechanisms of redress. And so with that, I'm going to turn it over to Jeremy and Deanna to talk about kind of how do we answer these questions and why a learning community was important to be able to do that. I'll turn it over to Jeremy from JSI here.
Great, thanks, Sadhana. Hello, everyone. Great to see you all. Great to see the turnout and the sort of sustaining energy for this work. The fire's still burning, to borrow an image from those previous slides. I did want to echo something I think Tanae said at the beginning, that this has really been a true partnership, and acknowledge also 3 of our organizations get to chat with you today. 2 of our partners, Lily Farhang and Human Impact Partners, and Caroline Fichtenberg and the SIREN team at UCSF are here and will be fully engaged in the learning community. And it really was an example of the adage that, if you want to go fast, go alone. If you want to go far, go together. It's been a rich and productive partnership. And the learning community will be involve all 5 of our organizations fully. JSI is going to be providing administrative support. So Deanna and I get to talk a little bit more about the details of the learning community. Let's go to the next slide. So I want to start with just a little bit of interactivity and ask all of you to put in the chat what comes to mind. First, 1 or 2 words when you hear the words learning community. What do you think of? Cool. Collaboration, sharing, exchanging, support, transparency, co-equals, sharing best practices, reciprocity, diversity and partnership, sharing, listening, learning, bring expertise, collaboration, best practice, fostering innovation, co-creating. Frontline experiences, interesting. Okay, cool. Journeying together. Awesome. These are great. Okay, good. And they're all positive, which we like. That we have a positive framing of learning community, which is kind of how we're thinking and approaching this as well. Let's go to the next slide. So, hearing Sadhna talk about the guide kind of rekindled my pride in that work. It's been a while since I looked at it, and there's a lot of good stuff there. Though, I think, as Sadhna, you were remarking at the end, part of, I think, what we were trying to convey somewhat paradoxically in the guide is that equity work can't be accomplished by following a guide, right? It's going to require kind of a deeper and longer sustained effort. There's this temptation to look for a kind of a quick fix. And the reality is that there is just not an equity certification that can be given based on filling out a checklist. That's just not how this work is going to transpire. And I'm sure this is not true for the folks who are gathered here today, but I think we've all had conversations where there is this temptation to, okay, can we put in, a training program for staff? Can we diversify our staff, and can we set up a community advisory board, and then we're done? That's sort of our equity work, and that's really not the sustained level and time commitment that's going to be necessary to get to the sort of outcome that I think we're all looking for, and the kind of impact that we want to have. It's also really deeply contextual. So, there are factors around history, geography, leadership, local politics that have an intrinsic impact on where any given institution should start this work. I mean, this is reflecting on the comments in the previous section as well. We really, I think, believe in this kind of the process part of it, and these steps that are laid out, and the efficacy of actually having a structured process and hitting those different steps. But exactly where any institution's going to start and progress is very much contextual and individual, and needs to be customized. And lastly, we're all learning to do this, right? Again, I think the guide is a starting place, but it is not an ending place. And so there needs to be spaces for collective learning, figuring this out in a way that focuses on impact and sustainability and accountability, so that we can really put the ideas that are here in practice effectively over time. So all that led to it making sense to create a space for a small group of motivated and accountable health institutional partners to join with us in thinking about how to actually implement and operationalize the guide. Let's go to the next slide. So in very sort of broad strokes, the goals of the Learning Collaborative are to create a real community of diverse voices of peers who are working towards similar goals, to work together to co-create responses to barriers to sustainable equity work. So yeah, this is, if what you were looking for was a didactic experience where periodically you'll sort of come and we'll have in sort of the mode we're in right now that we'll be presenting. That may be some of it, but really we're looking for a co-creation experience. And actually that I think sort of echoes a lot of the sentiments that all of you put in the chat around what a learning community should look like. There definitely will be some, we are going to be focused on identifying priority strategic practices that you can implement and move forward. So, in addition to sort of troubleshooting broader issues across, collective issues that are identified, also specific strategies for specific sites and contexts. And lastly, this is a learning experience, and we want to tease out learnings that can be shared more broadly, that can impact others who are doing this work and inform the field more broadly. Next slide. So another way of coming at this, which I'm sure is a question that you all are asking, is, so what do I get out of this if I participate? So I think this kind of dynamic learning environment that we're committed to creating, that's balanced also with some sort of customized support that pertains to your context. And Deanna is going to go into some more details about this. Some of the sort of specific skills and strategies, a real focus on accountability, both internally and externally. So you'll see we're very committed to this being not just an experience for healthcare institutional staff, but actually that community partners are involved from the beginning. And lastly, you get to hang out with all of us. I mean, that's definitely part of the appeal, is that it's an opportunity to connect with these 5 organizations. And depending on kind of that co-creation process, we'll also bring in external experts if there are topics that the group wants to go deeper on, that warrants bringing in that expertise. So yeah, that's sort of at a high level. So Deanna, why don't I turn it to you and you can get more into the details.
Sounds great. Thanks, Jeremy. So great to see all of you today on the call. I'm going to get into sort of the nitty gritty of the learning community. We can go to the next slide, where we're going to look at the timeline and the activities that are involved. So the program year will last a year, as mentioned, and teams will participate in 5 sessions total, which includes the kickoff call, 3 quarterly webinars, which are convenings, which will be virtual for now, and then a closeout session that will happen. The focus of the sessions, as Jeremy mentioned, are not solely going to be didactic, but rather really interactive, lots of discussions, lots of practical cross-learning that's happening. And the curriculum won't be set in stone. To the co-creation and the collaboration that was echoed in the chats, we will base what the curriculum looks like specifically on the needs of the teams that are involved, which we'll glean from the application, which I'll tell you a little bit more about in a minute, and through feedback throughout the program. We really hope that this is a co-created and iterative process that's addressing needs as they shift and change throughout the learning community year. Teams will also have blocks of time dedicated to receiving individualized coaching. You'll see those blocks under the coaching sessions, and technical assistance from us as the 5 teams, kind of leading the group, but also, as Jeremy mentioned, if there's others that we feel we need to bring expertise into, teams will receive coaching from them as well. We can go to the next slide. So what are the requirements? Who are we looking for who should participate potentially? So those that are interested should be committed to advancing racial and health equity in partnership with community-based organizations, including equitably resourcing community representative participation. And you'll see in the application that we do ask about relationships that you have with community-based partners and what that currently looks like. We also are requiring that you'll be in the early stages of an equity plan or an equity plan refresh. If you've had something previously and are maybe thinking about ways to improve it or iterate based on changing needs. Thirdly, being able to commit at least 1 team member to attend all learning community sessions. And as I mentioned, those are just 5 throughout the year, so hopefully not a requirement, a hard requirement to meet. And then the last thing is willing to contribute $25,000 to support the facilitation of the learning community and synthesis and dissemination of learnings. If we go to the next slide, we do want to make note related to the cost of the learning community that the inability to contribute may not be a barrier should this opportunity be a good match or a good fit for you or for your organization. If you are unable to contribute, there's opportunity in the application to describe your circumstances, and we'll assess alternative approaches. But we strongly recommend that if you fall into that bucket to get your application in as early as possible so that we're able to plan accordingly. Okay, so what does the application look like? We want to learn more about your organization. We want to learn more about where you are. What are your motivations to applying? If you're in that refresh, what's kind of the impetus for that refresh? If you're just starting out, what are some of the things that you've been thinking about or doing previous? Who have you been talking to? What is the state of your racial and health equity plan to date? Also, we'll ask for your proposed team members. So as a part of this learning community, we mentioned that it'd be great to have one, but to go in a little bit more detail, the team members should be somebody who is responsible for implementation of health equity within your organization. It can be up to 2 to 4 members that kind of fall under that bucket. Also are requiring for you to have a community organization participant. It could be an organization or a CBO that you have engaged with for a long time, you have a long-lasting relationship, or maybe one that you're interested in deepening a relationship with. And we're also requiring from the team member standpoint, having some sort of executive support that is able to give a letter of support for the work. Lastly, what we're asking in the application, as opposed to, in addition to all of the different details regarding your organization and where you're at currently, if you'll need support paying for the community, as we mentioned, this may not be a barrier to participating, but we'll just need to know that ahead of time. We will drop the link to the application. It is currently live and you can go in there now. There's plenty of links to the guide that you can look at. It also will be a link to where the webinar is from the first kind of detailed explanation of the light and heat guide. We also have PDFs of the application. I know sometimes it's easier to print out and look at it ahead of time before kind of filling it out through the form. We also have kind of a one-pager info sheet that provides a lot of the information that we're going over today, just kind of in a more concise format. We'll also be uploading the recording. 3/6 is an ambitious date, but we should get that up in the next week or so. So we appreciate your patience there. Go to the next slide. So before I turn it back to Tanae, I just want to really encourage you to consider and think about and take a look at all the resources that are available on the Light and Heat Learning Community application. They will be due March 24th at 5 p.m. Pacific time, and we will notify teams by May 1st. So take a look at that today and consider applying.
Thank you,
Yep.
Deanna. So here's the deal, everyone. All of us are in this room because we believe in the pathway forward for health equity, for racial health equity in our hospital organizations and systems. There are several questions that were submitted in advance of this call today, and we were reviewing the questions. My takeaway is that we have the answers in this room. It's not for us to be prescriptive and say what needs to be done in each person's institution. It's for all of us collectively to talk about what we know, what we've learned, what we've tried, what works and what doesn't work. That is what this learning community is all about. And it is only as successful as the commitment and the ideas and the opportunities and the wins are that we have all had in our work that we've done independently. So we know that $25,000 is a lot. And what it does is it says that we are committed to the work. We can't do health equity or racial health equity without committing the resources, not just financially, but also with time and space and alignment of how we think about this work. So that is what this opportunity is. It's an opportunity for us to create space to learn from each other, to start to develop promising and eventually best practices. And so for that, I encourage you to review that light and heat health equity guide, and also go ahead and apply. All of this is important, and we're only going to get to that solution if we go far together. If there is nothing else from my colleagues, I am going to say thank you for joining us today. It has been a pleasure to see representation from across the country, and I look forward to seeing you on the other side, hopefully in the learning community, but definitely we appreciate your commitment to this effort in general in health and public health. Thank you.